Good morning. Welcome to South Dade Shoutout. My name is Richard Candia. I'm a realtor with Avanti Way of Homestead, but I am also privileged to serve on the board of the South Dade Chamber of Commerce. South Dade Shoutout is an opportunity to meet some of our chamber members and colleagues, talk about the industry they work in, and shine a light on the value that they bring. Today, we're joined by my friend, Mr. Kenneth Wright. Ken is an insurance agent, but if you know a little bit about him, he's more a consultant than an agent. He's a guide. He's a savant. Ken, it's very nice to have you join us.
Richard, it's great to be here.
Thank you. Thank you. We got a lot to cover. I am learning a lot just speaking with you yesterday, the times before that we've had a chance to have a conversation. So I hope you can help steer this conversation a little bit if I step out of line a little bit. Let's begin with some basic information, even if it seems trivial. What are the basics of health insurance? What should our self-employed chamber members be asking?
Well, I mean, the thing that everyone cares about are two things. Number one is, what are my coverages? What are my out-of-pocket costs? And what is my monthly premium? All right, so I'm going to make it real simple. What I suggest to everyone is, if you're looking for a health plan, what you want to do is if you're healthy, the highest deductible plan with the lowest premium makes sense. If you're unhealthy, oftentimes a higher premium with a lower deductible makes sense. So that's kind of just like a very, very basic thing. And then the other thing is who's in my network? Whether you have a doctor that you want to see, or a doctor that you already have as part of your individual network, that's going to help determine what type of plan you might choose, because some doctors are in some plans and some doctors aren't in other plans. And then the other thing is, what we always say in the insurance business is, it's not the care you need today, it's the care you may need tomorrow. And that's going to help determine also what kind of plan that you're going to choose.
So there's a lot of responsibility placed on us, the consumer. I have to be aware of the menu. I have to also be aware of where I am in my life cycle. And a guide like you becomes that much more important. So it's a very competitive industry. It's changed over the years. As you were telling me, with the passage of the Affordable Care Act, it's changed quite a bit. But what have been some of the biggest things that have happened in the last, say, 2 years or the last year?
Well, a couple things have happened just recently. One of the things people have always complained about is, and it's a big thing that I complain about, which is, what is my out-of-pocket cost going to be? What is actually covered by my plan, and how much will I be responsible for? For the longest time, you could not contact a hospital and find out what a procedure would cost. You couldn't contact a doctor's office and find out what a procedure would cost, or what his costs or her costs would be. That is changing. The other thing that happened is that you'd go to an emergency room, and if you weren't in network, you'd have to pay out of pocket for it. Or a situation that you almost just recently ran into, which is receiving procedures that are out of network, being unaware of it and having to pay for it.
Sure.
So what's changed there is, a year ago, January 2021, there was the Hospital Transparency Act passed. And what that means is that all hospitals now have to report what their costs are for procedures. So that passed over a year ago. As of right now, 14% of the hospitals have reported that information.
Right. Well, one, very low compliance rate, but two, how am I trained to see the information they're going to give to me? Is that going to make any sense to me at all? Well, do they have to pass another law to say, hey, spell it out so that the layman can read it?
That really. So what's happening right now with that is, the hospital information is pretty easy to read. There's a group called Turquoise Health that is providing some of that information. But the other law that was passed just in January of this year, which is the insurance company's transparency final rule, that is with respect to insurance companies. So maybe you aren't aware that Dr. Smith gets paid $50 for a procedure from Blue Cross, and they might get paid $100 for that same procedure from United Healthcare. That information is now going to be available. The problem is that information is not readily readable by the average consumer.
Sure.
So there's certain companies now popping up that's going to translate that information and make it available. So even though the bills and laws have been passed, the information at this point isn't fully available to the average consumer. But if you have questions about some of this stuff, the best place to go is to an insurance agent.
We right before we went live, we were talking about that, and I used a very pedestrian example of how we're just overwhelmed by information. I can make my own travel arrangements. I really can, but there's just too much other to select from. That's why a travel agent is so important. A real estate agent is important. As a consumer, how often should I be speaking to my health insurance agent? How is that relation? That relationship should be ongoing.
I mean, ideally, you would speak to them at least twice a year. One is when plan selection begins, and then at least 3 or 4 months into the year to see if the plan is meeting the needs of that individual. And those needs change. As I was saying earlier, if you are a healthy person, the needs you have in a health plan are different than if you're an unhealthy person. If you have a chronic illness, then you're going to receive ongoing care, which means that there's going to be a cost for it. And if you have a high deductible, there'll be an awful lot of money out of pocket. If you're a healthy person that only goes to see a doctor once a year for your annual physical, a very, very high deductible would probably make sense. And then you pay a lower premium. So you should talk to your agent both when it's time to enroll, but also at some point during the year to kind of review where you are with respect to your health status. And if anything changes during that year, you should reach out to him or her, or hopefully they'll reach out to you.
Well, this is interesting. I'm going off script here because this part of the conversation is interesting to me. If I'm checking with you twice a year because you're my friend, and I'm saying, hey, I'm feeling okay, and this plan seems to be working for me. Or if I'm having a life event, if I'm getting married, or my spouse and I are expecting a child, that changes things, doesn't it?
Well, if you're self-employed, especially, because then you've probably purchased in the marketplace, and you can always make a plan change during a qualifying life event. If you move even one zip code.
What's qualifying life event?
That's like moving one zip code, having a child, getting married, losing your job and your health insurance. Those are times when you can make a plan change. Otherwise,
anytime.
If you have one of those events.
Oh.
Otherwise, you have to wait until open enrollment, which usually runs from November 1 to December 15 for most plans, October 1 for some.
Interesting. Okay, thank you. I didn't. So it really, people stay in touch with your health insurance Savant. Okay?
Well, and what I'll oftentimes talk to people, and they will have only spoken to an agent once when they bought the plan, and they're not happy with their plan, and sometimes don't even know who they bought it from or how it happened. They try to find the best, lowest price plan possible, and maybe that wasn't the best plan for them.
That's a note that I just wrote here. Is that the right question I should be asking? Should I always be asking what's the lowest cost to me?
Well, it's like anything.
Where's the cost versus services? Where's that?
Well, it's like anything. I mean, maybe all you can afford is that used car that costs $500. It's going to perform much different than that initial, lowest priced, car that you would buy off of a lot that was used and that was certified, versus maybe you need a Mercedes. Maybe that's, what your healthcare says. So it really depends upon what your needs are. For some people, the lowest price plan might make a lot of sense. And if that's all they can afford, it's better than nothing.
Gotcha. Okay. Well, let's talk about our small business owners. What are the options then outside of the Affordable Care Act?
Well, the biggest, now to talk about insurance and how it's rated cost-wise, everything in the Affordable Care Act, which is what people think of when they think of the health insurance marketplace, is all determined by really three things: by where you live, by your age, and by your income level. So the more you make, the lower your subsidy level might be. Right now, really good news for a lot of individuals is if you make $40,000 or $50,000 a year and you're an individual, there's a good chance that you're not going to have to pay very much out of pocket for a plan. And when I say that, 50, $100 a month, maybe, right? But if you make more than that, let's say you make $100,000, $80,000, there's a good chance you might not get a subsidy, right? So, so if you're an individual, what you want to make sure of is you want to look at what kind of government subsidy can you get on your health plan. If you're doing really well, you don't qualify for a subsidy, your plans can be really expensive. But there's an option. There are other plans out there that aren't income determined, they are health determined, just like a life insurance policy. If you are really, really healthy, you can get a preferred rate on your life insurance and pay a much lower premium than someone who's taking 4 drugs and has high blood pressure, and like that commercial says about, like, you know, Al or whatever, Big Al. So if you can qualify for underwritten health coverage, you can get a much better rate and much better overall coverage. Most of these underwritten coverages have national PPO plans, which means that you can pretty much see a doctor in any state in the country. Some plans, you can go to the Mayo Clinic, or you can go to MD Anderson in Houston, or you can go to Sloan Kettering in New York. Most state plans that are under the managed care confine you to care either within your own community, within your own county, or within your own state.
And are those plans usually sufficient as far as for extraordinary events, diseases for?
I'm a big believer in the healthcare system in the United States. Okay. And I honestly believe that any doctor that's certified, that's gone through the training, and that puts an MD shingle out is going to be competent. But some people want more than competent, and that's what you have to determine. Like I said, insurance shouldn't be for what you need today. Insurance is for what you need tomorrow. That's the whole concept behind insurance. So there's a chance that maybe the best doctor wouldn't be in one of these plans because they don't pay as much. But that's kind of the choice, you know, you're going to take by taking a plan like that. Is it sufficient? Yes, it's more than sufficient.
Best is subjective as well. I mean, I'm
not subjective.
I'm not the best example. I just recently started going to my doctor on a regular basis, and I've hit that age, and you're talking about the importance of lifestyle, the importance of maintaining health. Aren't patients? Aren't we? Isn't there like an incentive for docs to keep their patients on a relatively healthy lifestyle, to make sure they don't go to the emergency room, for example? No,
the exact opposite.
No kidding.
Yeah, doctors get paid when you see them.
All right.
So really, they're disincentivized to keep you healthy, because the more times they can see you, the more they'll get paid. And that's kind of, you know, so the idea is that the United States really doesn't have a healthcare system. It has a sickness care system.
Yeah, I've heard that.
Yeah, now, I can't think of a doctor who's going to try and, you know, get you sick so they can see you more often, but they are not incentivized by the insurance industry to take care of you for the most part.
What are the trends that you're seeing in healthcare coverage? Is that a legitimate question?
Well, I mean, the trends are pretty straightforward. So let's go back a few years now. You're old enough, you probably don't remember this, but you're probably old enough, like I am, to remember when it used to be something called every plan was an indemnity plan. It meant that a plan paid 8% of the cost, you paid 20% of the cost, or usually deductible of $500 or $1,000. And that's how it was. You knew that if you went to see a doctor or had a procedure, you were going to have an out-of-pocket cost. It was going to be that way.
Okay.
The problem is that the insurance companies felt that that was really costing them a lot of money, making it available for people to see doctors whenever they wanted to. So they wanted to rein in some of those costs. So they developed the managed care system where doctors became gatekeepers.
Right.
And what that meant was you would pay a small amount to see a doctor, $10, $20 copay, and then they would decide whether you could go see other doctors or not. People didn't like that, so they started developing other things like PPOs where you can go in network or out of network. But where we've evolved to now, managed care is still there in some shape or form, but deductibles have gone from $1,000, $2,000 to where the average deductible now is up to $5,000 for an individual, which when you're talking about a cost that could be $100,000, $200,000, $300,000, $5,000 doesn't sound like much, but for some individuals, it's still a chunk of change.
Sure. Then back to our chamber member, a self-employed business person, and let's say they have some employees and they're looking for a plan for their employees. What are some of the things that they're taking into consideration? Cost must be the biggest concern that they're looking at.
Well, again, hopefully the boss cares about the care too, right?
Well,
so again, it goes the same thing.
How do
right?
they bring it?
Yeah. So they have two options. Their options are, number one, to see, depending upon the population of their office, they can choose to go for a group plan, right? Now, everybody has the idea that a group plan is going to be the lowest cost plan possible. That's not necessarily true, especially in Florida when people are making $30,000 or $40,000 or $50,000 a year. Those employees oftentimes, if not all the times, can buy next to nothing.
Oh, wow.
Whereas if a company puts in a health insurance plan, the cost is going to be, let's say, $300 or $400 a month for the employer. Well, if he's going to charge the employee 50%, which is standard, the employee is going to have to pay more than he would if he didn't offer that group plan.
I saw in one of you have a series of videos that I encourage people to follow you and check out. A lot of good information there. There was a question that you left hanging, or did I have to go eat dinner? I can't remember if I finished it, but it said, if you're a spouse and you're covered by your spouse's plan, that may not be the best plan for you.
Yeah, that used to be guaranteed.
Yeah.
Again, the insurance business has really changed. It used to be an employer had wanted you to be happy as an employee, so they would offer you health coverage. Then they'd also offer it to your family at an affordable rate. I have a live example from last week. I talked to a client that's now in Illinois, and he's got a great job, and he's making 100 plus, 150 plus a year. He is paying $150 a month for his health coverage. Last year, to cover his wife and child, it was an additional $750. So he's paying a total of $900 a month for his health coverage. Great plan, really, really good plan. Worth it. A lot of money, but he makes a lot of money and it's worth it.
Sure.
This year, the company raised the premium for his wife and family to $1,400.
Ouch.
Yeah, and that's why they contacted me. So in the past, oftentimes the best place to get your health coverage for your family was at the company you work for. That's no longer necessarily true. There are a lot of people out there. School districts is another good example. In a school district, you'll pay next to nothing as the teacher or administrator. By covering your family, there's oftentimes a sizable bump. You say, well, why is that true? Why would a place do it like that? It's expensive to insure people. And no employer wants to pay for that insurance necessarily. What they'd like to do is make the incentive work for their worker. And if they can for the family, fine. But
I will be calling you. We'll be calling you. You had touched a little bit on hospital expenses. How can I compare plans, one plan to another, to make sure that I'm comparing apples to apples?
I'm not quite sure if you, again, there really is no apples to apples. I mean, that's the whole point. What people have to understand is that the insurance companies will always get their money, right? So right now in the Affordable Care Act market, there are different levels of plans. There's a bronze plan, there's a silver plan, there's a gold plan, and there's a platinum plan.
Mm-hmm.
And each of those plans pays a different amount of the healthcare cost, and applicant pays the rest. So for example, for a bronze plan, 60% is paid by the hospital, 40% is paid by the individual. For the silver plan, it's 70-30. For the gold plan, it's 80-20.
Mm-hmm.
And as those numbers change, the premiums and the deductible levels change. So it's really difficult to figure out. I mean, it really depends upon what do you want to spend out of pocket and what kind of gambles do you want to make with respect to your risk levels. And this is hard to figure out. It's a very, very complicated business. But not only is it complicated when it begins, most people, once they get a health plan, don't know what to do. And they're like, okay, I got my plan. I'm not quite sure where I should go to. I'm not quite sure, excuse me, what expenses are going to make the most sense. That's a role that I play. So I'm not just your insurance agent that sells you a plan and says, bye-bye, see you next year. I am available throughout the year to work with my clients. I am their 800 number.
I'm coming away with this with a larger appreciation of just how active consumers need to be in their own issues. Be it life insurance, be it health insurance. I had no idea.
I'm glad you brought up life insurance, because I'm gonna give a little pitch for my life insurance people out there, because I think the same thing, is that every 2 or 3 years you should review your life insurance plans to make sure that the industry might have shifted and changed, and your needs might have shifted and changed, and it's worth taking a look. And I know it's a lot of stuff to keep track of, but it really should be your agent that reaches out to you and says, hey, Richard, let's take a look at where you are. And you should say, okay, review my plans.
Yeah, you're not selling, you're creating a relationship. And if I can become dependent on you, you've done your job. We haven't talked about medication and the expenses of medication. Is that something that's already included in the type of plan that you select, or is that
it all depends? I mean, again, if you buy the lowest cost, lowest premium plan, oftentimes your medication costs might be full price until you meet your deductible.
Okay.
Your generics might be at a low copay, but I'm going to make a pitch for another product out there, which is GoodRx. If people haven't found or been exposed to GoodRx, look it up. You're going to often find times where you can buy a drug at a Walmart, well, let me put it this way. Every place that sells drugs sells them for different prices. So if you buy a prescription at CVS or Walgreens, it's going to be much different price than if you buy the same prescription at Publix or Walmart.
It's not a standard price.
It's not a standard price. And if you go on GoodRx, what you'll find is oftentimes you can buy a prescription for cash at Walmart that would be lower than your copay.
We are blowing the lid off of the whole industry right here today.
I'm telling you, though,
My
really,
gosh,
this is how people just don't know about.
So let's go back to our case study. I'm an employer. I'm a member of the chamber. I've got 10 people working for me. I pay, I think, a pretty good wage, but it's certainly, you know, they're doing okay. They're taking care of their families. Part of my planning, my business plan should be, I have my accountant, I have my social media person, I've got my health insurance person. If I intend to, because the plan might be not to have a plan. The plan might be to, let me give you access to the agent and I'll pay some whatever subsidized cost or something.
Well, you can't do that.
Can't do that either.
No, you can't do that. What you can,
I want to be a good employer.
What you can do though is give the employee a few extra dollars a month.
Okay.
That they are told to use for the health coverage. You can't pay for it yourself. Okay. So, and then it's really up to the employee then. I mean, oftentimes employees won't spend it on health coverage. but that's not, your call
Sure.
on that.
Sure.
And then for some employees, it makes sense for you to pay for them. And you don't have to do the same thing for every employee.
I wrote notes, didn't follow a single one of the notes here. Ken, we are coming to the end here, but I have to assume you've got a number of success stories. Give me a good story that you feel where you were able to help and it made a difference in that person's.
Well, I just gave you one just a second ago, the one about the family where they saved, I think that we ended up finding a plan for them. It was at $700 a month, which was the same thing that he was paying previously rather than the $1,400 that the company was going to charge. So that's one. The other thing is I got a referral last week from one of my friends, and it was a woman who is her manicurist. The woman's going to make $20,000 this year. Okay. She doesn't have any health coverage. Well, she came to me and I was able to tell her, you don't have to wait for open enrollment. You're below the poverty level, so I can get you free health coverage right now. And not only that, but I can give you a plan that's going to reduce your deductible to only $500 rather than the $5,000 it's supposed to be.
Wow.
And that's going to only be $90 a month. So you're going to have your health coverage, you're going to have a deductible hedge. She could not have been happier. So those are just two. One is a plan where I found somebody something in the ACA markets at a cost of nothing. Another one was where I was able to save a family over 50% of what they would normally pay. So that's two examples.
Ken, when should somebody call you? And
today.
How can they reach you?
Today. But I want to talk about one last thing that's
Sure.
I really want to get out there.
Please.
One of the biggest things that people are concerned about are their out-of-pocket costs. I don't care what health plan you have, you're going to have out-of-pocket costs for co-pays, for deductibles, for co-insurance, or maybe there's something that's not covered by your insurance that's health-related. Maybe your glasses, maybe LASIX. I'm going to even say maybe plastic surgery, right? These things aren't usually covered by insurance. There's a new plan out there there's a new plan out there that will match dollar for dollar your contribution. And that amount can be used for any medical procedure that you want. There are a lot more details to it than that, but just in general, if you are interested in putting together a fund to spend on deductibles, co-insurance, and other types of health insurance costs that aren't being covered, that is something you can reach out to me for.
Yeah.
Because both coverages and then being able to pay for your needs are what I'm all about.
Ken, how can somebody find you?
Well, they can find me a lot of ways. Number one, I'm all over LinkedIn. I'm all over Facebook. I can send me an inquiry there. My website, it has come up in the up on the scroll, so you have that. You can call me. I'll give you my phone number. I have no problem with that. My phone number is 917-710-2453. Again, that was my number that I had in New York before I moved down here. I'm new to Florida. I've been down here 10 years now, but I love the cafe con leche and I love the lizards.
10 years, you're already a native.
Yeah. So it's 917-710-2453. And I am the health insurance savant.
I know.
And that's why people say, why use an agent when you could choose the savant?
Thank you very much, Ken. I encourage not only our members, I encourage everyone to reach out to you, to one of your colleagues, but really you want to call Ken. I think we've just scratched the surface on what people can expect from their plans.
Yeah, but I want to stop a second, Richard, because I want to say that I'd love you to reach out to me.
Yeah.
But if you have a relationship you're happy with, reach out to them. Just be active. Don't be passive about your healthcare coverage, both because the costs and the care you receive are really dependent upon you asking questions and trying to figure out what you need.
Yeah, it is an industry. It is an industry, and it has all the facets of an industry. It's selling something. There's a consumer, so be an educated consumer, and you are an integral part of doing that.
Well, thank you.
It's been an education. Thank you very much for your time.
Thank you. Thank you for having me.
And thanks for joining us today.
You're very welcome.